Lisa, hi, welcome to the show.
Thank you so much for having me.
So, why do so many people get injured when they're running?
I think the biggest thing is because running is so repetitive. It's not a sport where you are moving in different directions or even taking a break. I played softball growing up, and it's like so many different movements that you're going through stop, start, cutting. But with running, you're going straight ahead. You might be turning a corner or something like that, but the motion is so repetitive. And I think because of this repetitiveness, it just allows for a lot of overuse injuries to occur.
So, then there's a lot of discussion as well on, it's not actually your knees that are weak, it's not the injury proneness, but it's building up the strength and obviously building up the distance that you're going to run as well. So, I want to ask you your opinion on the myth of people being injury prone, like some more than others. Do you believe it?
I think that they could be injury prone, but it's not because they were born that way per se. Like some people might have a lot of hypermobility and they might be like an outlier, but most people who consider themselves injury prone are probably just because areas are weaker and they haven't strengthened those areas. I wouldn't say it's something that, they were born with per se. Like a lot of people will just say, oh, I was born injury prone, but they might just be weaker. They haven't done the proper strength training to address these areas, or they had one injury and that led to another injury. And then they're just stuck in this cycle and they haven't been able to get out of that cycle. And therefore they just think that they are injury prone. I think some runners are, but I think you have to dive deeper into like more about why they're injury prone or why they think they're injury prone.
So it's quite interesting you kind of mentioned that cycle that you do hear. Personally, I've not gone through that, but you hear people say, okay, I'm injured, and then they're better for like a week or maybe a run or maybe a month, and then they get the same injury or they'll have the same injury on like the other knee, and they're just like, what am I doing wrong? So what are they doing wrong? What can they do to break that cycle?
Well, I have a patient, for example, a one-on-one client. She went to PT for hip pain. They tried to fix her running form and they didn't do the best job, in my opinion. And it led to less hip pain, but now it led to Achilles pain. And then once she started getting out of that Achilles pain, it led to hip pain. So the whole idea of this cycle is that, the body is going to compensate when it's weaker or when there's stiffness. And specifically in different joints, every joint is a little bit different. But if you are not able to address this weakness or this stiffness without completely destroying someone's running form to where they're now taking in more load in an area where they're not used to, because that can cause injury, then you are just going to be, stuck in this cycle of injury. So it does have to do with what you're doing outside of running in terms of like strength training, stability training, mobility work, but also what's happening in your running form. So there's like a little bit of a song and dance to addressing your running form without causing more injuries, but also strengthening in a way that's not super painful and you're able to build up these areas of weakness.
I'm thinking out loud here, but you have say your right knee is just causing you issues, and you go to a physio and you sort that out, and you put a lot of work into it, a lot of rehab into it. Then you start running again, and your left knee is doing the same thing, or maybe it's your hips or your shins or whatever. Is that because perhaps now your right knee, which was the problematic one, isn't as weak, so now it's the next weakest thing that is actually causing you the issues? Is that right?
It could be that. It could also be, and I see this a lot, where if the right knee is in pain and now all of a sudden the left side's hurting and you feel like you're falling apart, could be because now you're putting more weight or force through the left side because your body is thinking, this is my stronger side. Brain is super smart. It's able to compensate without you saying yes or no. So it's going to put more force through the left side, less force through the right side because the right side's more painful. So it's going to find a way to decrease the pain. And then over time, if you're putting too much load through an area that's weaker, that can cause overuse injuries very quickly.
That's wild, isn't it? And how your body adapts, like
Mm-hmm.
overcompensate subconsciously. I'm sure lots of people who've done a lot of running, well, like you're running along and suddenly there's like slight dip in the road or a pavement and your body reacts before you even realize it. And you're like, wow, I didn't register that, but I've dodged it. Like, thank goodness. Or maybe you haven't dodged it and you're like, oh no, back to the physio I go. But yeah, it's wild when you think about that. And then your body is subconsciously overcompensating because it knows that this part's weaker. And then it causes all these other issues. And a lot of it's like the
Mhm.
psychological part of it as well. I find it so fascinating, the psychological element of our bodies, our physiology, and how that impacts our sporting performance.
Yep. And another good example would be because a lot of people, once you start picking up your mileage or your speed, you'll notice one hip might be a little bit stiffer than the other or tighter than the other. And it's so interesting because as much as we do want our body to be symmetrical between the left and right side, it's not. It's not, because if you look at our organs aren't symmetrical. If you look at our lower half, we ideally want it to be symmetrical. Like that would be our goal, but I'm not aiming for perfection here. And like, that's not realistic. Usually one hip will be tighter than the other. Usually one side will be weaker than the other. A lot of people will say like, this is always my like injured side. Like I know for me, my left side's a lot weaker than my right. And if I'm injured or have discomfort or pain, it's on my left side. And a lot of that can stem from like the pelvis region or foot and ankle. You know, it can stem from all these different areas. But what's interesting about the pelvis that doesn't happen anywhere else, because, you know, if I'm hurting my right foot, my left foot's not directly affected. Like maybe I'm putting more load through it, yes, but it's not directly affected. But if you look at the pelvis, if I'm injured on my right hip, then my left hip is going to have to make up the motion, or something is going to happen that is like very direct to what's happening at that right hip. So I find that very interesting how, you know, the pelvis is very, very, very related, where if the right hip is tight, usually the left hip has more range of motion. If the right hip is tight, maybe the left hip is a little bit weaker. Like ideally we want to be symmetrical, but it's not, it doesn't need to be the goal in order to run.
It normalizes, doesn't it? It's like, it's
Mm-hmm.
okay. But working with
Mm-hmm.
that as well. Like, as a physio, people will come to you like quite injured and say like help me or whatever, but say like someone's getting into running. I could use the example of myself. I've done a lot of cycling in my past, but now I'm getting more into running and I'm upping my mileage, and like my left knee at the moment is like slightly tweaking, but it's not injured at all, not causing me pain or discomfort. Between runs it hurts a little bit, but I'm not going to stop running. But what would you recommend for someone to do when they're not injured but they feel it?
Yeah, for sure. I mean, this is the phase where it is really important to jump on your rehab. You know, if I am going out for a run, I feel a little bit of my knee, you know, I'm not like super concerned about it, but I'm like, oh, that's kind of annoying. Then I'm not going to go jump into scheduling a doctor's appointment. I'm not going to go jump into my rehab exercises, because injuries can pop up and they can go away with running. That's the good part is, you know, not everything that pops up is going to stay and cause you to be sidelined. So I usually say, like, give it a couple days, give it a couple runs, see how it's feeling. Is it getting worse? Is it getting better? Is it staying about the same? And then after those couple days, then reassess it. And if it's still like 1 or 2 out of 10 pain, like light discomfort, I would start your rehab exercises. And you don't have to, I call them rehab exercises. You could just call them exercises. But because there's discomfort or pain, that's why I call it rehab exercises. But the whole idea is that you are addressing the knee or addressing areas that are a little bit weaker.
So what are the set of rehab exercises? Are they stretches or are they more strength stuff? I kind of know what you mean, but I also want to like define it. For people who are listening to this who are like, I know, but I also don't. What would you define it as?
Yeah. I would say your rehab exercises ideally should be exercises that are addressing why the pain is coming on. For someone, it could be stretching. For someone else with the same injury, it could be strengthening. Most of the time for runners, it's strengthening, if I'm being honest. I do not give out many stretches, because if you're a runner, you're going through this range of motion. So you usually have the flexibility. If I'm looking at true static stretching, you have the flexibility. You just might not have the mobility or the strength/stability of the joint.
Interesting. Because I was going to ask you, How important is stretching? Because everyone says, oh, it's like the most important. Everyone has to stretch a lot. But from your professional opinion, how important is it?
So there's different types of stretching. So I want to make this really clear that when I say I don't stretch, that does not mean I don't do, I still do a warm up and I still do a cool down. When someone says stretching, there's dynamic stretching and there's static stretching. Static stretching is when you hold a stretch for, say, 30 to 60 seconds. You think about if you grew up playing soccer, you just kind of sit there and like hold your foot. Like I grew up playing softball, it was just like hold your arm across your body for like 30 seconds. So I don't actually do much static stretching. I do more of this dynamic stretching where it's a dynamic movement pre-run where you're flowing through the motion. The goal is to prep your body for movement and increase the blood flow. And then after my run, I found that post-run mobility has a lot more carryover than post-run static stretching. So I already said static stretching is where you just sit and you think about a typical hamstring stretch. When you think about static stretching, you just hold and hold and hold. And even if your hamstring's tight, you still hold and it will still feel tight a month later. Because when you're doing mobility is flowing through that range of motion. Again, it's more dynamic than static stretching. But most of the time, runners have the flexibility. I say most of the time, this is not for every single runner, but most of the time they have that flexibility. They just don't have the joint mobility. So it's a difference between what's happening at the joint and what's happening at the muscle belly and the tendons.
It's fascinating. It makes so much sense when you say it. But then, we've all been guilty of sitting on the floor, crying into our hamstrings, trying to touch our toes.
Yeah, exactly. And the funny thing is too, like if you're like, oh, my hamstrings are so tight or my hip flexors are so tight. I hear that all the time. And it's like, okay, what have you done for it? Oh, I've stretched my hamstrings, every single day. I stretch my hamstrings. Are they still tight? Yeah. Okay, well, it's probably not helping then. And it's not addressing why they feel tight. Most of the time, a muscle will feel tight because it's actually weaker. And it's in a lengthened position to where it's weaker. So it just it's more about what's happening at the nerves in the muscle versus your brain's just playing tricks on you, basically. So it's more so what's happening at the muscle belly. And if your muscle is lengthened, and it's weaker, it's going to appear as tight. But when you start to strengthen it, then it becomes more into that quote, like normal position that the muscle should be in, the normal length that it should start in. So it's going to feel less tight.
It's actually wild, isn't it? The games that our brain plays on us in telling us that, hold on, like careful not to push it too far, like tightens up so you don't injure yourself and all that prevention that I feel like we could delve like so deep into it and still be being like, wow, our brain's doing this and then it does this. It's crazy.
Yeah.
So clearly you have a passion for physio. Where did that start and how did that develop into you becoming your job? It's what you do.
Yeah, I feel like I have a not so typical story for PT. Most people are like, oh, I just got injured a lot. I'm playing a sport and that's why I became a PT. For me, it's funny. It started in high school. It started in high school. I did not want to take physics in high school. And I was like, how can I get out of this? And there was a technical center for sports medicine. And I was like, I'm going to do that. That looks fun. I get to go to a different high school for half the day. Like that just looks interesting to me. Because I grew up playing sports, like very active. So I ended up doing that technical center. I went there every single day for 4 hours in the morning. And I learned so much about the body. I thought it was so fascinating. I was also somewhat good at it, which I appreciated. And I just was like, all right, well, if I'm going to go into sports medicine, then, there's not so many options. Like you're either like a personal trainer, you're a PT, you're an athletic trainer, you're a doctor, you're a PA. Like it's something in the healthcare field for the most part. So I went on to do athletic training in college. I thought that's what I wanted to do. I realized I'm way too distracted to watch someone every single play of the game, wait for them to get injured. Also, it's just like this is not for me. Like, I just knew it was not for me. I really appreciated more of like the rehab side of sports and like injuries. So I was like, all right, I'm switching it to PT school. And it just kind of escalated from there. So I got lucky with knowing what I wanted to do early on. I also love math and science. So it was kind of like fell into my lap in a way, but I'm very, very happy that I went to that technical center my senior year because that was way out of my comfort zone. None of my friends were doing it. So it's funny that I like when you apply to PT school, you have to have these prerequisite classes. And, in high school, I didn't want to take physics. And then it came back to haunt me. I had to take physics 1 and 2 for PT school.
Yeah, but also if you had taken physics and not done this other course, then it would have changed your entire path again. So it's quite funny how that one decision or deciding what you don't want to do actually ends up dictating your entire career.
Exactly. And like, I actually thought physics was super interesting in college too. I did think it was very difficult, but I thought it was very, very interesting applying like the math and science.
And then where does running come into this?
I started running consistently after I graduated from undergrad because I played softball throughout college. So I went straight to PT school after undergrad. And I was like, I gotta stay in shape. Like, I can't just be like a couch potato now that I'm no longer playing a sport. So I started running more. I love being outside. So I just started running more, but it was like always 2 to 3 miles, 3 days a week. Like, that was my routine for like 4 years. And after I graduated from grad school, I moved to DC and I was in a sports medicine clinic that saw like 80% runners. Like, it was insane how many runners that I saw. And they were all, about to run and the Marine Corps marathon. And I just got like very used to being around runners. I lived basically near the waterfront, so I would run a lot more. And that just kind of progressed into what I do now. In terms of the Instagram account, though, I created the Instagram account to keep myself accountable for running because I randomly, and I'm telling you, this is randomly signed up for a half marathon on New Year's Day after I was like still not running high mileage at all, just like same old runs. And I was like, what do I want to do this year? Oh, read a couple books, pay off some loans. Oh, it might be cool to run like a half marathon. Like, that would be cool. So I signed up for it and it was in November. And that's when I started getting more interested into racing and all that. So just again, stepping out of my comfort zone.
So with the physio work that you do as your day job, do you generally do it for runners or is it a lot of different people in different sports?
I would say it's 99% runners.
And what's the most common injury that you see these runners have?
It's funny because it comes in waves. I would say right now it's foot and ankle pain.
Oh, really? Why do you think it comes in waves?
I don't know. I really don't
That's
know.
quite
I mean,
weird.
it's not even based on like the time of the year. It's just, I don't know. It's like, it did that when I was in outpatient clinic too. And like a lot of people will say it like comes in waves, but it's always interesting. Like, it will be like foot and ankle pain. Like a couple months ago, I would have said it was like ITB pain.
And then do you do physio for both men and women?
Yep.
Both
In
men and
all
women.
ages.
Is there a difference? Because obviously if you're like a personal trainer for a man or a woman, you would do it completely differently based on men and women's physiology and the training that they respond to in their body composition. Do you do that differently for physio as well?
I do the same sort of assessment. I think the biggest difference, I don't necessarily change much of what I'm doing because I'm treating what they present with. So I will say, like, overall, though, males are more stiffer in the hips and ankles compared to women. I will say that. So usually it's a little bit more mobility, but I wouldn't say like I'm including this for men and this for women and like there's a dividing line. I would say it just depends on what they present with me because some men are very flexible and some women are very stiff in their hips. So again, it really just depends.
And then another, I don't know, I feel like it's got quite trendy recently, is the highly cushioned running trainers. And personally, I do love a highly cushioned trainer. It saves my knees, I can run on tarmac and it's fine. But if you think biologically, when we were created, we ran in bare feet. We did everything in bare feet. We didn't have shoes. Maybe then they had like thin shoes eventually, but and then you have these barefoot shoes as well with the toes, which I'm not sure. I'm not sure how people run in those. And they're supposed to be amazing for your feet. So then, what is
Mhm.
it? As like, is it actually good or is it not? Or talk me through. I feel like I'm distressed about it.
Yeah. I mean, there's been a lot of changes to shoes in the past. I would say even like 10 years. I remember in college in the summer, I was running in minimalist shoes. And like, I would never think to do that now. I think, you know, it just comes down to what shoe works best for you because everyone is created so differently in their foot and ankle and their gait and what they respond to. So, there was the regular shoes and then it went into like barefoot shoes and now it's like the most stacked cushion I've ever seen and now it's like carbon plated shoes. So, I think the big thing is like, first of all, what are you used to wearing? If you're used to wearing tennis shoes, like walking the dog, walking outside, whatever, then I would say don't go into like barefoot shoes because your body, it's what your body has adapted to. And I think that's where the barefoot movement kind of dissolved because people realize, like, that book Born to Run. So it's like saying that everyone is born to run barefoot and like maybe as infants, but we're not there. Our foot is very used to being put in a sole with protection and like that is what our body has adapted to. So if you consider that, then it's like, okay, well, if you're used to like walking around the house barefoot or like never wearing shoes, then maybe you would do well with barefoot shoes. But for me, that is not the case. My body does not respond well to that. It completely changes my form, which isn't necessarily a bad thing or a good thing. It just feels very unnatural for me. So I think like with the super shoes, you just have to be careful. Like, is it too much cushion to where you're having trouble pushing off the ground? Like, is the sole too soft? Because that's a thing. And then on the carbon plated side, is the sole too stiff? Because that's a thing too. So there's so many different like things to consider with shoes. There's not one best shoe for someone. Like if someone says that, even if it's the best selling shoe, it could be the best selling shoe because of the colors. It doesn't necessarily mean that it is the best shoe because it's whatever shoe you do best with.
I love how you call it the super shoe. I quite like that.
I have a couple super shoes and like that is what I'm used to. I'm used to a certain heel drop for my long runs, for my speed workouts. Like I know what my routine is and what my body responds best to, as in like how do I feel during the run? I know I do well with a wide toe box. I know that my carbon plated shoes are a waste of money because they're too skinny and my foot needs to spread out and the shoelace comes untied, which is all the time, which is insane for a $300 shoe. So it's like you have to know what works best for you. And like just because someone else is running in these carbon plated shoes, they were able to take 30 seconds off of their race time or mile time, whatever. It doesn't mean that it is the best one for you.
But it does sound quite cool being like, I'm running in carbon plated shoes.
Yeah, I actually just did a lot of research on it the other day because I was like, okay, whenever there's a new trend, like research has to catch up eventually, and it's slowly catching up and like it's kind of all over the place if you really look at it. Like some studies are like carbon plated shoes allow you to run more efficient and it's basically because that your foot can push off the ground without it like squishing down into the sole and then pushing off the ground. Like it's able to push off the ground and it's more efficient. But then other studies are like it doesn't change your running economy and it doesn't change your performance. And then other studies are like it completely changes your foot and ankle biomechanics. Like it very much so increases your risk for a bone stress fracture. So like you just have to be really, really careful. Like if something is too good, you kind of need to pump the brakes a little bit. Like if it sounds too good to be true, maybe just pump the brakes a little bit and just slowly incorporate it and see how you feel.
And I guess, as you say, everybody's different. They'll respond to things differently. So then just also
Mm-hmm.
gauging that. And maybe it is a super shoe or a super duper carbon shoe if we're going with the
Yeah.
carbon one as well. And then
Yeah.
for some people, it just wouldn't work.
Yeah, I know. I'm seeing a client for arch pain, and I had her record herself running in like 4 different pairs of shoes because I wanted to see what was happening at her ankle, and like it was very clear that the Brooks Ghost Max, where there's max cushioning, just caused her ankle to collapse in. Like there was no arch support there compared to like an A6 Cumulus, where it's like, okay, it's a little bit more arch support. It's also a newer shoe for her. So it's just like, again, I'm going to guess that she felt better in the A6 Cumulus. She said she did compared to the Brooks Ghost Max. And it's like, that doesn't mean that the Brooks Ghost Max is a bad shoe. It just means it's not what she needs right now.
I bet she's glad that she went to you and spent the money on physio rather than spending the money on 4 pairs of shoes that end up not working for her. And she's either going to get injured
Yeah.
wearing them or just be like, oh my goodness. Because they're
Yeah.
expensive, you say, like a lot of running shoes, especially if you're going for the super shoe. I actually love that description. It just makes so much sense.
Yeah, exactly. I know when I got injured, like my first running injury was when I signed up for that half marathon kind of impulsively. And the first thing I did was blame it on my shoes. And like this was like 5 years ago, and I was just plain patient at the time. And like, you know, that's pretty much what my patients do now. And it's like, oh, I was so excited. I spent like so much money on these new shoes, thought it was just because my shoes were dead. And like, I take 10 steps in these new shoes and the pain's back. So it's like, okay, it's good to try a different shoe when you are in pain. But, you know, if that pain is still there, you can't just think that a new pair of shoes will fix everything. It's usually a combination of a couple things.
So, what should people look for in knowing if a shoe works for them? How should it feel?
So this is the good part about shoes now is that you can like order them online. First of all, you don't have to go anywhere. You can order them online. You can try them out for like 90 days or 30 days because that's really important. Because I know for me, when I've tried shoes, I'm like, this feels great in the store. And then I go for a run. And I'm like, why is my foot numb? Like, that's not fun, you know? So I think the biggest thing is like, try it out on a run and see how it feels versus just like, you know, don't be fully committed into the shoe just because it feels comfortable walking around the store. I think
just jog around your living room. Think this
yeah, exactly. Exactly. And don't be surprised if you get like, you know, the version 6 that you love and version 7 is completely different too. But I think for the big things that I look at in a shoe, you know, make sure it's lightweight. I think that goes a long way if you're running longer distances or even like working on your speed. Wider toe box. I think that some shoes have the narrowest toe box. So like if you have a higher arch, or smaller feet, you could get away with a more narrow toe box. I have a very flat foot. It swells like crazy. I swear when I'm like running a hot run or long run, then it just, you know, it spreads out more and because of gravity. So I need that wider toe box. So I think that's really important. And then it depends on your arch and like what you need. I know, you know, like I said, I have a flat foot, so I need a little bit of arch support in my shoe. It can't be too soft. It also can't have a very intense arch support or else it won't be comfortable for me. So comfort and making sure it's lightweight, look at the toe box. Those are the biggest things.
And how's your running relationship with running gone? So you started your Instagram account, which now has a huge following, and you started this half marathon, you trained for it, and I assume that you liked running because you've kept going and kept running. But how's that been with suddenly then having this big audience, the pressure of that as well, and then online, everyone's an expert at everything, but you're actually qualified to know what physio is and how to fix people, how to help people and rehab people. But then everyone has an opinion. How's that been, that process?
It's been interesting, that's for sure. It's definitely been interesting. I think the biggest thing for me is just staying honest about everything that I post. Honest as I can, like making sure that I'm not, you know, people call me an influencer, but I don't like that term because, you know, I have my doctorate. And I feel like my presence online reflects my doctorate, but I just want to make sure that, sometimes I'll catch myself like, if I want to work with a brand, do I actually like this? Or am I just doing this because I want to promote this product? So there's been a lot of back and forth in my head about a lot of things. People, when a reel goes viral, it's not necessarily the best thing because then everyone's opinion comes out and they're not always the nicest of words. I can get really butthurt about it, and it's just a reflection on them. I have to remind myself it's a reflection on them, not me. It goes back and forth. It kind of depends on the day. Luckily, most of the running community is super supportive, super appreciative, and super nice. You always get those outliers who just want to tear you down, but I just have learned I used to give them the time of day, and now I just don't even bother.
It's not a nice process though, I'm sure. And you will remember the negative ones, and then you'll have so many positive ones as well, and you just have to keep them in mind. Our brains aren't really prepared for that, are they? Like whole world of social media.
It can be bad as it's bad as a male or female, but it can be bad as a female. You're already having a bad day. It might be a certain time of month, and then you read a certain comment and you just find yourself like crying and like you just feel very defeated. Like, why am I even doing this? But I think, you pick yourself back up. You realize that you're doing this to help someone who can't run because, I said I signed up for a half marathon, and that was pretty impulsive of me when I first, signed up for it 5 years ago. But the full story of that is that I never ran that half because I got injured. And I was like 7 weeks into training out of 12. I got injured, really weird injury. So I couldn't run that half. Took months off of running, was in a very dark place, was able to pick myself up, rehab myself, and then finally, had my breakthrough half marathon the year after. But that I want to help, that was the version of me from before. So I think if I remember that and how I felt, because if you can't run, running's your hobby, sure, but it's more than that. It's, it affects your mood, it affects your sleep, it affects your relationships. And I had that firsthand. So I think when I'm able to really think about like, why am I helping someone? I completely understand that it affects more than running. It affects your self-confidence, your self-esteem. So I think when I really think about why, I'm helping someone, then it's like, who cares what people say online? Like, they can say whatever they want. They aren't the people I'm helping,
And as you say, there's such a huge part of it's part of a lifestyle. It's not just you go for a few runs a week. It's a massive part of life. So then when you can't do it, there's a huge mental aspect as well as a physical aspect of going through the recovery and rehab and such. So what are your tips from your own experience, but also from working with patients for people who are going through that and are actually struggling mentally with it more than they are physically doing the recovery for their injury?
Yeah, my best tip that I always tell my one-on-one clients and the people that I work with is to look at what you can do. I completely get that maybe a month ago you were running 13 miles on a Saturday and now maybe you're running like 2, or maybe you're not running any. I completely get that this is a very different weekly routine, but we can't look at what we used to do. We can't look at what we want to do. We have to look at where you are now. Otherwise, it's going to be really hard to get better because you're playing that comparison game. There's a good book called The Gap in the Gain that I always reference. It basically, to sum up the book very quickly, it talks about how your mindset needs to look at what you can do in that moment versus where is the gap? What can't you do? So for example, if I'm injured, I'm not able to run right now, but I'm going through the rehab process. I need to look at, okay, I'm able to do these exercises. I am able to do 3 sets instead of 2 sets. I notice that there's less weakness on the left side. I'm noticing that my hip is loosening up. I'm able to do that. That is my mindset. It's a mindset of almost like gratitude versus saying, oh, I'm just stuck doing these stupid rehab exercises and I can't run my 10 miles with my group. Oh, this is like ruining my weekend. Like, I'm not going to be able to PR in the spring, whatever it is. Very different mindsets. And that's going to, once you realize and you're picking up on what you can do. And this is a really cool mindset shift that I see injured runners go through. You're able to then be very self-aware of what your body is feeling, what it's going through. So, and I love this because most people, before they get injured, they're like, I don't know if my left hip is tight. I don't know if it's weak. I just go through the motions with my like strength training. They don't say that, but it's basically implying it. And then when they go through the rehab process, it's like, oh my gosh, my hip is getting so much stronger. I didn't realize how weak it was. I'm able to now do like 10 reps of X exercise that used to cause me pain at rep 2. I'm now able to do 10 pain free. So you become very self aware. And I think that is super, super cool. That mindset shift is like a breakthrough mindset shift because you're going to take that with you after you finish the rehab process.
For sure. And if someone's listening to this thinking, okay, I need to get my strength game up, I need to do this, what would be 3 to 5 exercises or whatever that you would recommend them implement? And what frequency would you recommend that for them?
Yeah, I recommend strength training 2 to 3 times a week. If you are running, I think all runners need to strength train, especially if, it doesn't matter your pace, doesn't matter your experience. You just got to start somewhere. I think ideally as runners, we do want to progress into unilateral exercises or single leg exercises. But if you think about a couple exercises that you could do, this could be with or without weights, but push-ups are a great one to do for your arms. You need strong arms to run strong. I think deadlifts are great, squats, lunges, any sort of like jumping, even jumping rope is really, really good for running because it allows you to develop that Achilles springiness, I call it, or elasticity and like that Achilles power. And then like side planks are always good. Planks are always good for the core. I don't know the last time I've done a crunch. So you don't need to do any crunches.
I think crunches are so overrated. People say, oh, just do lots of crunches. No, I don't think they even make that much of a difference. They hurt your back. You've got to lie on the ground. Just not keen. Just not keen.
Yeah. Yeah. I have like a lot of tension in my neck and like carry it in my upper traps. And anytime I do a crunch, I feel like I'm just like straining my neck and I'm like, yeah, we're not doing this. I'm also not aiming for a 6-pack here. So we're good. We can skip.
No, not a fan. My favorite one at the moment is rollouts. They're horrible, but
I have definitely. Are you using that little device, like the tool where you roll out? Oh my gosh!
You're like, am I
remember...
going to fall on my face? Am I not? Oh, I'm back.
I might even still have a scar. I definitely busted my chin in a sporting goods store doing that with my brother when we were younger on tile floor.
Oh, that's
right. Like, we have to go, Mom.
Yeah, that's the thing, I guess, because it works on a wheel. If you're on a tile, it just shoots out and off.
Yeah. I guess my core was a little bit weaker then.
Or you just went in full pelt. You just committed.
Yeah, exactly. I don't have one of those, so now you know why. But they are really good.
Such a mixed review on the rollout tool. Like, not for me, but they're good.
Yeah, do it at your own risk.
So I'm thinking about people who run into their 60s and 70s and, as we get older, we lose our muscle mass and all this kind of stuff. What can people do to give them the best chance of being able to run when they're old?
If you ran when you were younger and now you're older, I think it's doing the same routine, but just having different expectations. I think, a lot of older people that I work with are like, I'm not as young as I used to. And this is very true. So we need to adjust those expectations. And that might mean that, you are careful of doing a speed workout in on a hot day or something like that. Like you're just looking at your heart rate a little bit more, monitoring your heart rate, giving yourself a little bit more time in between, your speed reps, whatever it is. I think just being a little bit more aware of how you're feeling. And this is true for any age, if we're being honest, but make sure that you're not lying to yourself about how you're feeling. I do catch a lot of older people doing this where they're like, I'm fine. It's like, you don't look fine. Like, what's going on here? We got to be honest with ourselves in order to find the best route that we're going to go down, So I think, you should still be strength training. You should still be doing mobility. You should still be running based on how you're feeling, based on effort. All of those things are still true. You should still be fueling, sleeping. Like, nothing really changes, but I will say, like, I'm 30 now. So when I was in my 20s, I could get away with, not stretching or like kind of doing like the bare minimum, it seemed like. And I felt fine, but you can't necessarily do that when you're older. Your joints stiffen up a little bit faster after a run. So you just have to be more careful and more aware of how you're feeling.
I know it's probably really annoying as a physio, but I do love the thought of like a 70-year-old person like lying, like, no, I'm fine. I'm fine.
Yes. Yep.
Crucial.
It's like, are you?
I don't think you are, but cool.
Yeah. Exactly.
And if you could put like one message out to all of your followers, all of your clients, what would it be?
I would say just one message. Oh, that's hard. I would say that you probably just need to keep going. It's, on social media, it's like, do this one exercise. There's this new exercise. Do this new trend. Um, Whatever it is, like, it's just trying to get your attention. It's clickbait for a reason, but chances are you probably just need to keep doing what you're doing in order to progress or, hit your goals. I think, obviously if you're injured, it's a little bit different, but if you're, say, like, you're just trying to run a longer distance or run faster, you might just need time. Time is something that we cannot buy, and we want to buy it because, we want this magic pill to speed everything up, speed the progress up. But a lot of the time, it just takes more time, more reps. You learn from doing these reps, and that allows you to get 1% better. I PR'd my half 2 weekends ago, and this was after 3 years of trying to PR half. So I think it's like, and I'm also younger, and like I've learned so much throughout that time that it hasn't even felt like 3 years. I'm not even close to the same person I was 3 years ago with my running journey. So I think, stay consistent, because action is going to lead to more clarity. Action is going to lead to you figuring out things or like realizing things that you need to tweak or now implement into your running routine.
Yeah, I love that. Consistency. It's just such a superpower, and it literally is the
Mm-hmm.
core of everything. And it's that 1%, just as you say. And it's not always going to be a beautiful black and white drone shot of you running somewhere with lovely music and an inspirational quote. Sometimes you're going to have to go home early because you feel so rubbish, or it's
Mm-hmm.
raining and it's dark and you're going really slow even though you're trying really hard. And sometimes it's great, but it is that
Mm-hmm.
reality that, as you say, it's slow. And on Instagram, on social media generally, it can seem like an overnight transformation. But
Mm-hmm.
it's, I
Yep.
guess, keeping that reality that no one can do it that quickly. Even the professional
Exactly.
athletes who are doing the most amazing sporting performances have put in years of work, like little bricks.
Yeah.
They build up and up and up. And then their breakthrough will look like it's a breakthrough when actually it's built on this massive pyramid of work.
Yep, exactly. I think a lot of runners too, like, will compare themselves to other runners. And it's like, okay, first of all, we are not elite runners. So we need to make sure that we understand that, we don't have to go hard every single workout. And the other thing is, like, when runners start running, we see all these runners on it, social media, and they're like, oh, slow pace, 7-minute mile. And it's like, that is not, my slow pace at all. That is my sprint if a tiger is chasing me. And I think, like, comparison can definitely make you feel like, oh, I just must be doing something wrong or like whatever it is. But I think just know that if you're running, you are above average. Most people do not run. Do not even worry about those people's paces, because again, like, they could be making that up. We don't know. That might not even be their easy pace. Like, you don't know the full story, so just focus on your journey.
But even when we're talking about shoes, and obviously everyone's feet are different and they will respond differently to the shoes, and we're all like, oh yeah, that makes sense. Everyone's a different size feet and size shoe will work and different types of brands. But when we say that our performances are different and it'll take different times and to get to a certain place, or different consistency, different training, that's when people get lost, when actually it's based on our bodies and our time scale and our motivations and what we actually want to achieve as well. And, you know, as you say, as women, like every week is different in the month. Some are easier and
Yes.
some are more difficult. And it's just working with our bodies because they're amazing. Do you know, it's amazing that we can go out and run a half marathon or a marathon or, you know, whatever people want to do, or do all of these strength things. It's pretty
Yeah.
cool. Yet we beat ourselves up about it and compare ourselves to everybody else when we just shouldn't, but we do.
I think for me, like, too, it's like, okay, if I find myself comparing myself to someone else, I just put my phone down and do something else. I think before I would just like get in this cycle of like comparison, and it's like I literally almost did not start my Instagram for runners because I was like, I'm not a fast runner. You know, like I had a bad run. It was also in the middle of summer, like 102 degrees. And not saying like I have bad runs all the time, but I remember this distinct run. I was running with a run group. I had trouble keeping up. I had trouble breathing. And I was just like, I had told myself I was going to start posting more like informational stuff on Instagram to help runners who are injured. And I was like, just totally like imposter syndrome. I was like, I can't do that. I can barely run this 5 miles right now. Like, who am I to help someone when I'm running the most average pace out there? Like, I'm not super fast. I'm not running marathons at the time. Like, even if I wasn't running marathons, like, I just totally was in my head. Like, who am I to help somebody? And I really almost did not start this Instagram. And I was like, no, I'm going to do it. I'm just going to commit to it for a couple months, see how it goes. So I think it's like, you know, if you keep comparing yourself, you might be holding yourself back from something incredible, life-changing, really.
Exactly. And if your friend came to you and said that entire story, you'd be like, look, you're amazing at doing this. Like, you have
Mm-hmm.
all of this content to put out. You're qualified in all of the things, information that you want to put out there. You're doing the thing. And also, you're trying to speak to people who aren't elite runners. Therefore, why would
Mm-hmm.
they relate to someone who was an elite runner? Like, you want to actually have that relatability. And if you think about everyone, like your audience, for example, that you've built up now, imagine how many people you've helped for all of the different
Mm-hmm.
elements of it, whether it's motivation or confidence or actually the like rehab and physio and the things that you actually do for your job as well. There'll be so many different elements and a lot of the things that you won't even know about because people will just think it and not actually say.
Mm-hmm.
And what is it like? I don't know, every message you get, there's probably like 20 people who think it.
Mm-hmm.
And if you think about that, it's like, well, goodness me, imagine if I hadn't. It's like going all the way back to the start of our conversation. Imagine if you had taken that physics class. And it's just weird, isn't it? How we get inside our own heads and
Mm-hmm.
let the fear of what we could fail at actually dictate what we might achieve. Like if we don't do
Yeah.
it, if we're overrun by it, then we're going to be limited. And how sad is that we might be limited to something that we're just not actually enjoying doing, not is not our passion in life in doing.
And I think that's something where I can connect well with my audience because I share these real life examples. Like, but the week before my race, I had imposter syndrome if I could even like run this race and PR it. Like, I was like, oh, it's going to rain. Like, there's hills on this course. I did not know there were hills on this course. Like, totally in my head. And like, I have a podcast episode about it. It's like, you can just see like I'm spiraling and then I pick myself up and then I pick myself up more and pick myself up more. And it's like, it's okay to have these thoughts. Like, we're human. That's okay. It's how are you going to pick yourself up after it?
Yeah, exactly. Exactly. And if people want to follow you online and keep up to date with the information you're putting out, but also what races you're doing and what running you're doing, where should they go?
On Instagram, you can find me at dr.lisa.dpt, Dr. Lisa DPT. My TikTok is the same, my YouTube is the same, and then my podcast is Rehab for Runners.
Incredible. I will link all of those below as well, and be sure to check them out. And thank you so much for coming on today, Lisa. I've really enjoyed our conversation.
Yeah, thank you so much for having me.